Ladies and gentlemen, today we are going to talk about what is trending, and that is coronavirus. And what is coronavirus? It's a type of virus which has not been previously identified in the body of humans. It looks like the flu. And how does it spread? Coronavirus is spread by droplets or by airborne, but the extent to which it travels is not all that far because they are very heavy. So when you come into contact with an infected person, especially when the person coughs, sneezes, then you are likely, and the droplets touch you, you are likely to be what? Infected. Or maybe when someone's hands are infected and the person used it to touch the knob of a door, a pen or something, then you also happens to what? Touch that particular thing, then you are likely to what? Get it in your hands. So once you get it in your hands, and maybe you happen to use your hands to put in your eyes, scratch your eyes, or in your nose or in your mouth without washing your hands, then you also get what? Affected. Okay, let's look at the symptoms of this coronavirus. Some of the common symptoms of the coronavirus is fever, cough, and sometimes a little running nose. In the severe cases, there is pneumonia, that is shortness of what? Breath. And when this happens, then you have to what? See your doctor. But not necessarily, because already we have normal what? Cough, normal running nose, but respiratory disease, when you are having problem with your breath, know that that is a severe what? Case. Okay. Let's look at some of the myths within coronavirus, because people are saying when you get corona, you will die. No, it's not like that. Coronavirus is just a mere disease, but it's not that as soon as you get coronavirus, you are going to die. No. According to a Chinese researcher, about 44,000 people who got the coronavirus. Out of the 44,000, 81% were mild cases, like weak cases. They were just weak coronavirus. They don't even feel like they are sick, just that they feel normal, just that they have the disease and they can transfer it to others. So it's not that when you get it, hey, you are about to die, then you have to start sharing your properties because you are. No, it's not like that. It's just something. So you must clear that out of your mind. You must clear that out of your mind. Even out of 100%, 4.7% are severe cases. That is, they have to support them with oxygen and other things, and then you see them pressing their chest and all. That is just about 4.7%. That is the severe cases. So it's not that when it gets you, then you are good. No, it's just like Qatar. So one should not fall into the belief that when you get coronavirus, you are going to die. No, it's not like that. Just that, except for those who are having what? Underlying health conditions or old age. That means you see that their organs are already weak, so it becomes more severe, and if they are not likely, they will die. So let's look at the prevention. There is actually no vaccine for coronavirus, but you can take what? Antibiotics. That is when they send you to hospital, they will give you some life support care. They give you some antibiotics, and then they monitor your organs, especially your lungs, your kidneys, just to make sure that the disease doesn't the virus doesn't spread to those areas. And with time, your body, your own immune system will fight the disease, and then you will recover. And let's also look at how do you treat coronavirus. There is actually no treatment to coronavirus, but you can reduce the risks. You can only reduce the risks. And reducing the risks, that is by washing your hands with soap for up to 20 minutes. At least don't just go and open the tap and then that is all. No. Try to wash your hands up to 20 minutes. Or if there is no soap, then you can use a hand sanitizer gel, like something like this. You just have to spread it inside your hand, and then you get something like that, and you rub it around all your hands, and you are free. Just, and thirdly, also avoid what? Touching your eyes, scratching your eyes. Maybe you are moving, your eyes are itching, then you start putting your, because you might have touched the virus. And then also avoid putting your hand in your nose and then what? In your mouth. Also, try to avoid people who are suffering from flu or maybe catarrh. You see the person is having running nose, and then at least, I'm not saying you should run away from that person, but at least distance yourself at least 3 feet from that person whilst you are talking to that person. Because you know that there are some people, when they are even speaking, you will see saliva spreading out of their mouth. And those people, if they are having the disease, that means they can easily what? Spread the disease to you. And I can see that people are saying when you take lemon, when you take garlic, when you take what and what. No, it's not true. When you take lemon is good because it what? Contains vitamin C, and that one will boost your immune system, but it doesn't prevent the coronavirus. And this one, lo and behold, is a warning to Africa, because Africans have the belief that Africa is hot, so for that matter the disease cannot spread. It's not like that. Or Africans have black skin and with very hard blood, or what kind of strong immune system. No, that is not true. That is not true. Rule that out, because all the desert areas, that is Saudi Arabia, Dubai, Kuwait, Bahrain, Iran, you can see how it is affecting them. Iran has about almost 17,000. Iran, almost 17,000 people are affected, and it's also a desert area. So you must avoid what? That particular thinking that no, just practice the hygiene, and if you are lucky, God will what? Protect you. But don't say that you have a black skin or you have a strong immune system. No, that one doesn't work. That one doesn't work. You just try to what? Practice those things, and then we see with time everything will what? And in a situation whereby you suspect that you have the coronavirus, the first thing to do is to isolate yourself. Don't let your children come closer to you, or your wife, or anybody, friends or family. Just try to what? Isolate yourself, so that you reduce the risk of what? Transferring it to other people. Then once you see that the cases, like those symptoms, because there are some rare cases like shortness of breath, vomiting, then that one you can call the hospital. Do not transport yourself to the hospital, because if you are going to transport yourself, maybe there is the likelihood that you transfer it to more people. For instance, if you go and take the public transport, then you breathe out, you are breathing in, you are holding the seats and other things with your infected hands. So you are going to infect more people, especially in Africa, where you have to go to the hospital and sit to get folder and other things, pass through so many things. But once you call the hospital, they will come and then what? Pick you with their ambulance, so that you will reduce the risk of what? Infecting other people. Currently there is no vaccine, though America has come out with a vaccine. They tested it today, but it will take about 8 months before they start using it on human beings. So we just pray and abide by the rules and regulations, and see how God is going to. And before I forget, for instance, if you are going, you can always carry a tissue, so that when your eyes are itching, you simply use the tissue to clean your eyes or your nose or your mouth, but don't use your hand. And if you are going to sneeze or cough, you can use the tissue, then you cough inside, then after that you what? Dispose it off into the trash bin. I think that will help reduce the risk of what? Infecting other people, in case you are having it. Thank you.